Okay, good afternoon, night, good morning, students. When just took the privilege to record this session and for the benefit of the class. So, and for especially those who were absent when we were having the presentation, right? So, for the sake of because I'm ill, I'm not well, sorry, I don't want to come into the school and, you know, pass on my infection to anybody. I'm not saying I don't know what it is, but just the flu. Nevertheless, so jumping right into the presentation. Um, the majority of your exams will be based on legal terms and conditions. Some of what Ms. Samuel had presented in class on last Monday, I think it was, I would give you a guide as to the presentations as well. So please take note of the session, the class today, right? So we're talking about the legal terms in nursing profession. So I'm just going to recap. I asked you all to review the Mental Health Act and the Nursing and Midwifery Act of Trinidad and Tobago, and that was basically for the benefit of her class and of course for your general knowledge as well, right? So we did discuss this slide. Just now, let me move this. We did discuss this slide where we spoke about the licensure as to the importance of a nursing license. It is a legal thing. You must have a valid license, and you cannot practice without a license as a registered nurse. We spoke about your being accountable and only being able to accept the assignments that you are competent in and well trained in. We spoke about that as well. We spoke about the organization and the policies within the ERHA or the RHAs, sorry, that you will be working with, whether it is governmental or private institutions, right? And we mentioned these aspects of the licensure and nursing on the whole. Now we spoke about the law, and a law is a body of rules. I want you all to pay attention to your definitions, please. The law is a body of rules, of actions, the conduct, and basically prescribed by the controlling authority and having legal force, which must be obeyed or ought to be followed by the citizens that sanction these legal consequences. Now, or sanction subject to sanctions or legal consequences. Now, if you do not obey the law, there must be consequences. It's the same thing as we want to apply it in nursing or in the healthcare field or the medical practice. If you do not abide with the ethics, which is the laws of nursing, you would be held accountable, and you would be now not only being held accountable, but face consequences, and we're seeing that a lot now in society. We have the definitions of law here. I'm just recapping for the students who missed the classes because we went in depth with this. Ms. Samuel also went in depth with this. We talk about a stature. What is a stature? So now we want to go into health laws, and I just want to pinpoint a few things here for you all, right? Not really health laws basically is really transforming the healthcare from one level, because remember we spoke about nursing and how nursing evolved, right? So it's basically the same thing we were speaking about, how the healthcare system is evolving. We no longer have to go down by the bush doctor, right? As in some societies, but in our society where we live in the Western world, now we tapping into a more medical, a more trending, a more advanced, a more technology based healthcare system, where we're speaking about vaccines. We want to implement all these types of new and improve methods to improve healthcare, right? So we're talking about transforming the healthcare system. So now we're talking about the healthcare bill, the second acronym, this diagram here, we just mentioned in the healthcare bill. This is in Parliament. Well, in our country, it's Parliament, right? Where we have any legal laws and legality. We're looking at the healthcare laws and legality. So now, healthcare now is not only just as hearsay, but it is legal. You must go in America and in other countries, they go to Congress. In our country, we go to the Parliament, where they sit on laws, where they study laws, they discuss, they have round table discussions where they have the stakeholders that are needed to implement these laws. Excuse. And we form healthcare legislation, whether it is approved, whether it's not approved, healthcare reformation, judicial branches, and new practices. Don't really, bombard yourself too much with this. This is just to highlight that nursing practice, whether it's general or psychiatric or any form of nursing specialty, it is a legal act. Yeah, and you must have license, and it's not only legal because you're forming policies and you're taking it from a healthcare or a regional health authority. This is state-wise. This is government. This is serious business. Okay. So our laws in our healthcare system, we're looking at the laws in the healthcare system. Now there are 4 types of laws, right? When you're talking about laws in general, there are 4 types of laws. They have statutory law, common law, civil law, and criminal law. What we are dealing with in nursing and in healthcare is civil law, where we see in, this is the light blue one there. That is the main subject of civil law, is to resolve disputes and disagreements between individuals by providing compensation to the aggrieved. Sorry, students, it's just really tiny on my screen. So basically, that is what it is. The civil law is dealing with compensation. Now, it's not a criminal law, because when you look at criminal law, you would that is what the police uphold. They will uphold criminal law. Well, the police will uphold all the laws, right? But they class them in different categories. But our focus is on civil law, right? So for us, simple. What is civil law? They are laws required to deal with rights of the persons rather than crimes one may commit. Okay. Now, let us say, for example, we just recently had an issue there again with a baby dying in a mother, right? The mother was apparently stayed too long in labor, and the result of it was the baby dying. Now, yes, can we say it's a crime? It's a criminal act. Having a dead baby is a criminal act. But when you're talking about or when you want to refer it to the medical practice, it's not like they came to work that morning to say, okay, we are going to kill 5 babies today, or for the month of January we are going to sacrifice 10 babies throughout Trinidad and Tobago. So it is not like that, right? Now that will be like serial killer and all these things you just watch on Element, these type of movies, right? So what we're talking about is civil law. Now, a civil law is something that we will go into that as well. Remember, we talked about the torts being intentional and non-intentional. We spoke about the torts being malpractice and negligent. So let us go into that, right? Now, remember the terms, remember the definitions, please. I'm begging all you. I am trying to have my paper ready for exam for you all on Thursday afternoon at 1 p.m. Once Mr. Murphy gives me the okay and he confirms it, I would have that paper ready for you on Thursday afternoon, next week Thursday afternoon at 4 p.m. Right? Okay, so the branches of civil law, we have tort, which we're speaking about, contracts, property, and family. Now, we want to really focus on tort, because tort is really what is the civil law that nurses are under. So we are under the umbrella of the civil law, and tort for civil law issues, tort is one of them. And that is what we really want to focus on. Now, when you are employed and you go with the regional health authorities, contracts come in. Now, you can break your contract. And we look at the ERHA Act. Remember the Act when you came into class one day and I spoke about the Act. If you had to study, you're supposed to tell the ERHA because you don't want to break your binding contract. Right? You're not supposed to come to work drunk or under any form of intoxication that is breaking the contract. You don't want to you want to avoid having any legal or criminal issues in the court without informing the RHs that you are employed with. That is also breaking the contract. So that can be a civil law. If you are found out, right, by the authorities, they can send you home because of that. right? They could terminate your contract and send you home. That is the right, because a contract is a legal document that you sign and say, yes, I agree to work anywhere in Trinidad and Tobago. Yes, I agree to abide by all the the rules of the RHA, right? You sign that contract, you put your signature and your time and you date it, and you say, I agree to these things, terms and conditions. And by you breaking those terms and conditions, you are breaking the contract. Yeah? Property, we will discuss property, one level of property where we're speaking about when we come in contact with the patient. And for those of you all who was in class as well, Miss Samuel did speak about that, where she spoke about collecting and holding the patient's where we hold the patient's property, right? We will touch on that as well. And family, because remember, nursing is family oriented. We do not only deal with patients, right? We also deal with the family of the patients and the community. Okay? Okay. So we did speak about the Good Samaritan law and who the Good Samaritan law covers, and I did tell you all that the Good Samaritan law covers us healthcare workers when it is called upon us to operate under the umbrella of the society. Sorry guys. The society, meaning that if there is an accident on the roadway and you are the nurse, or you're traveling, or in your own private transit, and you see an accident and you stop to offer assistance, if you offer that assistance, your assistance is required and you still offer the assistance, if something was to happen, that Good Samaritan law will cover you. However, you must not practice recklessly. Yeah? You ought not to practice recklessly. If you do not know how or what to do, as the same thing we said before, if you think that you are not competent enough, do not play superhero, because then the Good Samaritan law will not cover you. Yeah? Good. So we're going again, into the legal terms. We're talking about thoughts. We said these thoughts, we've mentioned this already, have unintentional and intentional thoughts. Right? Those of you all who wasn't there, read the slides. I'm just recapping. Tort is a civil wrong, because remember, we're talking about civil laws. So tort is a civil wrong made against a person or property, right? We're talking about denying a person's legal rights, failure to comply with public duty, failure to perform private duties that result in harm to another. We spoke about that. We spoke about the intentional thoughts. Intentional thoughts, you want to cause foreseeable harm to the patient, talking about assault, battery, invasion of privacy, false imprisonment. And yes, we can say that this is very close to criminal law, because criminal law also have assault and battery, right? But let us look at it from the nursing avenue and the nursing perspective. Don't get too caught up into the different types of laws, but we just want to focus on what our civil law has taught, being intentional and non-intentional, and how does it cover us as nurses, and how can we fall into that issue, right? Oh, because we don't want to fall into that. So we talk about the intentional thoughts, false imprisonment. We spoke about all these things, right? Invasion of privacy. We discussed this. So we as budding nurses, you all must remember that the patient's information is private and confidential. We must only, and we ought to only display these information to the persons that the patient says is their next of kin or legal guardian. However, there are certain issues that these things are amended from, and we spoke about the abuse. Ms. Samuel came and she spoke about that. She spoke about the mentally ill patients, right? I hope you all took notes. She also sent the PowerPoint. I did share it with the class email. I hope everybody got it, right? Attempts of gunshot wounds, knife wounds, rape, communicable diseases, and suspected crimes. We as nurses are responsible, yeah, for even suspecting a crime and not reporting it, right? Unless so this is the only how we will actually breach invasion of privacy. We spoke about the confidentiality and ethics, right? How we ought to maintain the patient's information. It is confidential. You ought not to go home and share your information and telling the person's date of birth, their name, the age, and you're giving a whole handover to your relative. Yeah? Or you and your husband or you and your wife in bed sleeping, and you say, babe, Mary Jane came in today, you know her? Yeah, that's the lady from down the road, the woman who owned the shop down by Bellamy Street corner. Yes, that woman. Remember how she had 2 children? Yes, the daughter, Carrie Emmanuel. Yes, that girl. She come today, and if you see how much man she have and these people think, and she have all this. No, no. That is break her confidentiality and be patient's privacy. Right? You ought not to share any information. And when you have to share information, you're only sharing information based on these issues we've seen here again. Gunshot wounds, child abuse, vulnerable adult abuse, and certain communicable diseases. And it's not the Tom, Dick, and Harry you're sharing this information with, but persons who is in authority and what is required for you to share, who it is required for you to share the information with. Right? So please bear that in mind. We spoke about the legality and respondent superior. 6 major categories. Alright, so nurses, we are liable to follow the standards of care. Equipment, use failures, because you will be if you don't, you'll be liable. Right? And we spoke about what is our liability. What is liability for nurses? Right? So when you are liable, you are responsible. Okay? Your keywords. Remember the keywords. We're making links here now. And your failure now to be responsible, to hold on to your professional ethics, failure to follow your rules and regulations and your proper training, you now would be liable for that. You will be responsible for that. You will be held accountable for that. You will be now called to answer because you failed. Right? So you failed to follow your standards of care. You know that the patient's supposed to pull up. When the patient is on the bed, the patient is semi-conscious or unconscious, and the patient is on the bed, and you ought to pull up the handrails. You know that, and you fail to do that. Whether you forget or you don't forget, you would be liable. Failure to use equipment in a responsible manner. So the patient supposed to have a blood sugar testing done. You do it on an extremity or on a torn ligament, or let us say a sinus edge, the finger edge, and you do not get a proper reading, but you write down the proper reading, and now the patient now is mismanaged because of failure to use proper equipment on the patient, and that's your responsibility. Failure to communicate. You saw the patient random blood sugar is 412, and you said, you know what, it is 412. That's all right, it will go down. Let me go to the washroom first and come back. You go to the washroom, you forget about the patient. Now the washroom is important because you must meet your elementary needs. So you go and you eliminate in the washroom. Elimination needs, sorry. You go and you eliminate, you pass urine or you defecate or whatever in the washroom, and you come back and you forget the patient. You go on extra with somebody else, not knowing that the patient blood sugar is in the 400s. Now the patient blood sugar continues to increase. You had done it. Even though you failed to document, that's another thing that is coming down. The other one is failure to document. You also failed to communicate. So now you are liable for 2 acts that you didn't do. You did not tell and you did not write. Right? And then we go in again. Failure to act as a patient advocate. So you see, in all aspects, you as nurses we are responsible. And if we do not take up the mantle and practice within our scope, we will be held accountable, and now we will be liable for our patients. Yeah? We spoke about the student errors and omissions. And yes, we said we agreed that it would be, because you will be held accountable. You would remember, okay, let me make an example. If, for example, You have a learner's permit. Like my son is telling me, Mommy, I want to pull out a rental. So I was like, okay, how that happening? Well, yeah, go and pull out a rental. I say, I don't understand how that happening. You have your learner's permit. You are not licensed to be on the road by yourself. That is the same thing as a student nurse. You're not licensed to practice on your own. You must have a registered licensed practitioner there with you. You must have a licensed registered driver sitting on the side of you, whether you want to go left, right, up, down, north, south, east, west. Right? You must have a licensed person there, or else your license could be revoked once you are caught before you even get it. Yeah? So we're looking at this, so you could use that analogy to remember as student nurses, you are also responsible. Okay. So we want to get into the meat of the matter. We spoke about negligence and malpractice. We spoke about the non-intentional torts. These are both non-intentional torts. Negligence occurs when a nurse fails to follow the established policies and procedures and standards of care. And I could remember that in the PowerPoint presentation that Ms. Samuel also gave, she gave nice and simple definitions of negligence and malpractice. Go over it, read it, understand it, apply it. Malpractice is also non-intentional, and it have 6 elements. We will not go into that 6 elements at this time, but it causes, this is where now you as a nurse, you're causing injury to the patient because of the act that you did or did not do, right, leads to harm by which the patient can seek now financial compensation, right, because of the harm. We spoke about the assault and battery. Spoke about false imprisonment, defamation of character, slander. We said what a libel is. Yeah? Assault, threatening the patient. Yeah? If you don't go up and stay in that bed, I will tie down your hand. So and so and so. Assault. Battery is the unlawful touching of another without their consent. Right? But in mental health nursing, that's why you will have to read the Mental Health Act. Even though your patients have rights, the Mental Health Act will cover them. Sorry. The Mental Health Act will now cover the patient from staff members who may use their authority forceful to break the code of ethics and break the human rights code as well and cause assault and battery. And this is when you will now be called to go before the court, and you have to plead your case. And if the court finds that you are guilty of battery, then right, you'll have to pay the consequences. Yeah, right. So I got it. So now we have informed consent that we spoke about, right? So I explained that the client it's an ethical and legal right of the client to give that information, to give that permission for the procedure and for the treatment. You cannot just go and just do treatment for the patient unless, because remember we spoke about the Good Samaritan law that covers us as nurses, unless they are in an emergency, because a patient who is drowning or had a near drowning incident, of course they cannot say save me. But a normal thinking person would want to be saved if they are drowning. Yeah? Because the first thing you will cry out for is help. Correct? So, the Good Samaritan law will cover us like on those circumstances. So your client must not be coerced. Pulling her hand to stamp the NIS check. Yeah? Or to sign the surgery or for organ donation. That must not occur. Coercing them. Say, well, if you do this, you know, if you give me the piece of land, I will take care of you. I will be a nurse from now until. I will always be a nurse. Do not coerce the people. You will find circumstances, you will recognize when you go out there the different type of treatments and the different type of circumstances that surrounds the patients. So they ought not to be coerced. The client understand the essentials. So we are going to do a prostatectomy. The client may sign, or the client might not sign. What is a prostatectomy? Are we going to remove your prostate? Okay. What is a prostate? Where is the prostate located? When or you might say, yes, I'm going to take out the prostate. Not a problem, not a problem at all. And when you go in, you might have to do a radical prostatectomy. The doctor might have to do radical. And the way they might go to do the radical prostatectomy, it may damage the pineal gland. The person might be a young person. Do they understand the ramifications of what can happen during surgery if all does not go well? Did you explain all the essentials to the person? Yeah? Okay. So bear that in mind. Follow all the agency protocols. That's why you have the doctors come in to check on you, the anesthetist come in to check on you, the nurse come in to check on you, you do your vital signs, you give your medication, you draw, swallow. Depending on how the doctor order, you go along with that. Please, because they are the ones that are doing the procedure. Yes? Check everything. Make sure your patient is NPO. And in your clinical rotation of general nursing, you would look at that as well from that general nursing avenue, a general nursing perspective. And so too, when your mental health rotation as well. Is the patient competent enough to say yes? Or do they have a childlike mind? Or are they just signing it because they just want you, as Nurse Samuel said, they see you there and they want you to be the nurse and they come in there just because you are the nurse there. But do they really want to be there? Right? Competency for consent. Are they competent enough to sign, to understand? Or are they bypassing everything and just looking at the beauty and instead of the actual picture? Right? They're looking at the nurse, they're looking for favor and not really looking at the issue itself. Consent in an emergency, even though they have an emergency and the patient is oriented, you still ought to get consent. Unless, as I say, the patient is near drowning or unconscious patient, right? And you are the bystander, then you would want to give care. But even though your patient, even though your patient might be coming, from a mental health perspective, you still ought to have consent in an emergency, even if it's by the relative. Yeah. And child participation in the decision making. Some children are intelligent enough to understand, and where the children are not intelligent enough to understand, then we ought to deal with the next of kin or the legal guardian, right? In all cases. All right. Okay. So we want to talk about the incident reports. Now, incident reports allow hospital administration to identify problems within the hospital system, right? It alerts the administration of an event that may end up in a lawsuit. It's important to fill out, one, to identify problematic situations and create a safe environment. So if we have an issue on the ward, if you have an incident on the ward, and Samuel spoke of many when she came in the mental health setting, right? And you do not fill out a form. Let us say, for example, a patient may come in. Let me say, for example, forensics. A patient may come into forensics, or with bad behavior, or let's just say the suicidal patient. And and you notice that the patient now is verbally threatening not only himself but threatening the other patients. And you say, nah, you close your eye, you close a blind eye to that. Your failure to communicate, your failure to document, and an incident occurs. So you did not document any patient notes that patient was verbally abusive to such and such. I love to write in reading pen. My reading pen always have ink. I just tell nursing staff and patients that. Just recently I had to document the center was closed When we arrived, we had patients standing outside, and these are not hospital patients, these are clinical patients. So you have the outpatients that come from home for treatment and they go back home. If they have an emergency, then you call ambulance and they send them to the hospital for admission or for further medical care. Now, because of the policy in each specific institution, other patients were not allowed to open the door. So she stood out there and she wanted to use the washroom, and she didn't tell the other patients what she wanted to come inside for. So she was pressing the buzzer. And of course, our hands would be busy at that time in the morning, 3-4 o'clock in the morning. So when our nursing staff was available, they went outside. And she was so verbally abusive to the other patients because they sat there, and to one patient in particular, she was abusive too. And she went to use the washroom and she came back out and she was cussing and carrying on. And I had to leave my duties and go out there and be a little respectfully stern. And I informed her that I would be writing in her notes of this behavior because it is not part of the institution's policy and we don't condone that type of behavior here. Whether you're paying your money or you're not paying your money, whether this is government or privately run, you must have a level of decorum upon yourself. This is not no jagabat behavior, right? So, of course, I didn't tell her like that. But I was very stern, with her, and letting her know that that type of behavior was totally unacceptable. You ought not to disrespect another human being like that. And on top of it, after the matter is resolved, you still come back outside and cussing and carrying on, right? I would not allow that, not on my shift. Yeah? So, had I not written that, incidents like that ought to be written. So you must not fail to document and fail to read. So I call the nurse in charge immediately and I let him know this is what happened, this is when it happened, and this is who it happened to. So peradventure something happens next week or next month, it is there in her notes about this type of behavior, and then the authorities now can take a foster action in terms of accountability. My hands are clean. Right? So you ought to fill out your incident report forms and document not what you think, but facts that you know. Your opinion does not matter. If you like the person, that does not matter. If you're glad the next man get cussed up, that is not important. What is important is exactly who did it, exactly when it was done, what was said. Well, of course, I would have paraphrased and shortened a few things and just put, I put FUMC. Those type of words were used. Capital in caps, in capital letters. Capital F in brackets, capital F, capital U, capital M, capital C. And I said, in those type of curse language, abusive language, those types were used. Right? So of course I would not be writing out all those things. Yeah. But most important, I placed a incident report there. So you're keeping your statements factual and objective. Don't come to conclusions. You are not a magistrate, you're not a jury. Do not come to conclusions. Right? And of course here we have do not mention the incident report in chatting. Right? But in our country, it is wise to do that, because the incident report will have all the aspects of what happened, ball by ball commentary. But when you're chatting, you will just put, it's kind of like if you write a referral letter, that what we would I will show you guys how to write a referral letter of the important things. And in your reporting now, you will just make a summary of what will happen. So it's not the same information, you will just transfer the information. No, it's a little different, but similar. There's a summary. And it may or may not be allowed in court, depending. So we don't want to reach the court, right? Okay, good. So now we get to the legal implications in the nursing practice, right? Let us discuss. So, malpractice and negligence again. Okay? Medical malpractice occurs when a healthcare professional, through a negligent act or omission, causes injury to the patient. negligence can be the result of errors in diagnosing, treatment, or aftercare or care of the health management. Now, because of the little box here, I'm not really seeing that word, guys, so please forgive me. So when we were going to the differences between malpractice and negligence. So it's a negligent act. Practice. Malpractice. Something that you did not do that will cause injury to the patient. Right? And the negligence now results from the errors. Errors in diagnosis, errors in treatment. Even errors from that will cause malpractice. Errors from the act itself. So it's like two sides of the same coin. The thoughts, right? You have negligence, you have malpractice. Very, very close, but still different. Okay, guys. So let us look at some of the acts of malpractice, right? How can we constitute malpractice? What can we say malpractice is? Failure to diagnose or you misdiagnose the patient. Now, remember we have nursing diagnosis and we also have medical diagnosis, right? So failure to diagnose or to misdiagnose, you bypass that fact. You say, oh, that's not important. The pain management, that's not important. The high temperature, that's not important. We have other important things. And you might want to justify. And if something happens, malpractice. Okay? Excuse. Misreading or ignoring lab results. We will go into that when we go into our clinicals. And you might misread or you might ignore the lab values. That's why we ought to know, right? And you didn't report it, and the doctor might misdiagnose. Then we are all liable. Yeah. Unnecessary surgery. We will discuss that as well. Surgical errors or wrong site surgery. Yes. So you have the patient come in for removal of left cataract removal, and you prep the patient and you document everything, anesthesiologist saw the patient everything, and you send the patient in clinic and they in OT now and they remove the right cataract. What if the right cataract wasn't they had bilateral, but what if the right cataract wasn't mature enough to be removed? Yeah? Or what if it was placed in a way that it will damage the patient lens or the retina and causes the eye to be damaged prematurely? So now your patient can't see in both eyes, right? Because you failed to report. Or you document incorrect information and you cause the patient harm. Malpractice. Improper medication, dosage of medication, proper medication or dosage. So the doctor said they want to have the patient get Valium, but you give Voltaren, right? Wrong medication, wrong dose. Or they want to have 2 milligram Valium, and to you that 2 milligram seems like an 8, and you pull up 8 milligram instead of the 2 milligram, and you overdose the patient. What is the consequences? Who is liable? These are malpractice issues. Poor follow-up of aftercare, right? Or aftercare. So you send your patient home and you forget to give them the clinic card. Simple things, Simple things like that. You forget to give the patient the clinic card, or you did not make the appointment for them to come back to clinic. Who is liable? Patient missed the clinic appointment, or the patient goes home and they doesn't know what to do. Right? They're more confused than anything else. Yes, we are liable. Right? Premature discharge. As well. Sending the patient home too early. I remember I told you all that about a doctor sending home a patient, and I told them that the patient was not, in my view, the patient was not fit to be discharged. And they still went home. They still discharged the patient on the second shift, the evening shift, because they wanted the bed. Well, we saw how that turned out, right? you must always know. Don't speak things that you don't know, right? Assess the patient, or if you're not sure about a situation, yeah, we will be young, and even as a student, it had sometimes I made decisions like that. I wasn't really sure. It had it's circumstance where I wasn't too sure, but I know the patient was not looking well at all, and I called the doctor, and the doctor came down on the floor, and he said, "This is what you call me to see the patient for?" I said, "Doc, the patient not looking well. They haven't really confused, and but because I don't know if it's because he saw it was a student or whatnot, he left, and 2 hours after." He had to rush back because the patient had a MI. I can't recall if the patient died, but the patient had an MI, and the nurse called him, and they was like, "But we just call you," and da 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 da, and he was speechless. He was not happy, and I was right there. I was glad to be right there, standing up in my little pink uniform, to know that yes, I did call you. So sometimes we ought to listen. Because I was so young, I didn't understand. I wasn't competent enough to understand the dynamics of what was happening to the patient. But I knew, and my gut feeling told me that this patient was not well. And by communicating with the patient every day, I realized that the status of the patient was deteriorating. So I called the doctor because I knew something was happening, but I couldn't really explain. Right? Maybe if I had spoken to a head nurse or spoken to a senior staff, and explain to them my findings, and they were the one to call the doctor at the time, probably the doctor would have listened at that time. But I did not use my resources. I just called the doctor directly. And when the doctor came and he saw the condition of the patient, he thought to himself, "Who called me? You, the student? You don't know what you're talking about." And he went his merry way, not knowing that in less than 2 hours after, it was about 2 hours after, the patient went into distress and he had to come and do emergency management for the patient. So probably in that time, yes, I was at fault to not tap into my resources because of you're a student, you don't know nothing. Come on, you out here, right? So next time, I was a student at that time, right? Start passing on that to you all. Disregarding or not taking appropriate patient history. So you don't want to, you have no time to take the patient history. Patient was you came in suicidal, but you didn't take time and sit and ask for the patient. So have you ever had suicidal thoughts before? How many times for the day you had suicidal thoughts? Have you ever had attempted suicide on yourself or on a loved one? Do you hear a voice talking to you and telling you that you should commit suicide? All these things. You hear what Nurse Samuel said? You must be watching the patient. Observation. Because all they could do is stand there and sit there and walk up and down watching you. So you have to be observant. You have to watch the patient at all times, especially if you don't know the person. You don't know the person, the patient, you don't know the signs that they might. Don't take it for granted that they're normal. They are there for a purpose. Yeah? Excuse. Failure to order proper testing. So you have a client and you might find that, their blood results might be a little off, or sometimes you go to casualty and the doctor will do an x-ray and they say, "Nah, patient okay," without doing a blood test. Sometimes the x-ray might show one thing and the blood test will show something else, that it can be similar or have a proper guiding, and they fail to do that. All that is malpractice. Failure to recognize symptoms. So yes, the patient say, "Yes, I've been having suicidal thoughts. Yes, I have a voice telling me to commit suicide." And because you say, "Nah, having a good feeling today," or you take it for granted that this patient is usually in a good state of mind, usually. They probably just having a little downcast today. They just probably having an odd day. Right? And something happens. Malpractice. Right? So we're talking about negligence. Failure to provide care that is normally expected of a person equally trained in that particular situation, resulting in injury to the patient. Now, once it results in injury, then the act is malpractice. But because you fail to do the care, Negligence. You neglect. Root word. You're neglecting to do the care. That is negligence. Remember I said malpractice, negligence, two sides of the same coin. So the act that results in harm is classified as malpractice. And negligent, practicing negligently, you're just doing things, helter-skelter, not critically thinking as a nurse, because it is the failure as you are as a student nurse or as a registered nurse. What a normal, good, critically thinking nurse would do, you fail to do that. You fail to think in that aspect. And it results, and that would be negligent, and it results in an act which would be malpractice. Close, very close. So, for example, ordered side rails left down. Patient falls from the bed. Now, two things happening here. Negligence is where you fail to pull up and lock the bed rails. Because you did not do that, you neglect to do that, and the nursing care, the patient falls off the bed and break the hip. Right? Now, malpractice now, because the hip is broken as a result of what you failed to do, then the patient have a malpractice lawsuit, and they will find negligent and malpractice because of your failure to perform as a nurse what a nurse ought to do. It resulted in a fall and the patient broke their hip. Now they need to be compensated by the regional health authorities, who will then file for a report. So want to know what happened if the doctors ordered that and you had bed rails that was up and it's supposed to be up and locked and you failed. What a normal critically thinking nurse would do. You failed to do that act. It resulted in it resulted in the patient falling. Then you have a negligent and a malpractice lawsuit. But you were negligent. That part of the act, you were negligent in pulling up that handrails. You saw the handrails, you forgot to do it. That is negligence. Right? Using or not reporting defective equipment that injures the patient. We spoke about the blood pressure monitor. Right? The blood pressure, let us say I want to set the monitor for, let me say, every 15 minutes. Q 15 minutes monitor, BP monitoring. And the timer is not functioning well, or you didn't set the timer for every 15 minutes. You say, I do it every half an hour. Me time by them I go on my rest. And the patient blood pressure drops. Patient goes unconscious. That is lawsuit. Again, you neglect. You neglect to do the correct thing. And it resulted in malpractice because now the patient is going to sue, or the patient relative. Eventually, the patient dies and the patient relative is now going to sue you. Yeah? Patient develops infection from a poor sterile technique of the nurse. Wow. That's hand in hand. That's both. Because it's a sterile technique that you ought to use and you're using clean. And we would look at when I'm doing the techniques with you all, when we're looking at aseptic techniques, you will see how many times we have to, as simple as hand washing, when we're doing medical hand washing, we're doing surgical hand washing, and normal hand washing, clean hand washing, we would look at the difference. So simple tasks like that, right? And all those pretty nails that we love to wear, and those lovely colors that I'm seeing in the class. Yeah? Soon we will look at it, and you're doing microbiology. So soon we will look at all the dynamics and what will constitute all those different actions that can cause negligence and malpractice in the clinical area. Patient burned from bath water that is too hot, and we saw that in Mount Hope, where the baby was burnt in the incubator. and it was stated that the midwife she neglected to test the water, the saline bag. They heated the saline bag in the microwave, and as a result, the baby was burnt. So because excuse me, because the nurse neglected to check the temperature, and that whole issue was wrong, because that is not even an act that we ought to do. They were trying to improvise, and um, that was negligence and malpractice. That was a big lawsuit. Yeah. So negligence again, failing to record important information on the patient's chart, all the vital signs, all that is negligence. You're failing to do it because of some issue. Probably it might be short staff. You might say it might claim to be short staff, but you sit down by the nurse's station, and this is you. Yeah. Just take the BP now and write it down. I'll come and check it just now. Yeah, problems. Don't end up in problems, right? Not assessing a client's condition, such as the blood pressure or blood sugar, on the time that you ought to assess it on. Sometimes you might find that, okay, we will give somebody insulin. Insulin is a chemical that we inject in the patient because the pancreas is not working properly and not producing insulin. We have artificial insulin, and we have different types of insulin. So we give the patient insulin if the blood sugar is very high. However, there is a sliding scale that we use, or a method that we use to inject particular amounts of insulin subcutaneously, which is in the adipose tissue right under the skin. That is a technique as well, and we would go through that when we get to that stage. Right? So you gave, or you did not give, the insulin on time, or you gave the insulin on time, but you didn't go to recheck to see if the blood sugar is dropping. And let's say the blood sugar, you check it, doctor say every 15 minutes, and this is you. 15 minutes. I on my break now, it's about 15 minutes. The nursing assistant, I don't know where they're gone. I am the only nurse in the world. It's about 15 minutes. Half an hour pass here and check it. 45 minutes to check it. Because you say the nursing assistant will come back. And you're there, right? And how long it will take to do an insulin, a blood sugar, a random blood sugar test? Not long. Not long. But you fail to do it. And the patient goes into a coma because the blood sugar drops. Yeah? Problems. You will be liable. Neglecting. You will be held for negligence, right? Errors when administering medication, and we'll look into that. Failing to report test results, as we spoke about before. So the patient blood results come back, or the x-ray is ready to be checked, and they're just there. Doctor's supposed to come back and make rounds, and they didn't come. They're there. The doctor's supposed to know what they're supposed to do, and they know they have 3 patients on this ward. Yeah, attitude sometimes. Missing significant changes of the patient's condition, or identifying them, but not taking the appropriate action. So you might identify the condition. You might notice the patient is pacing up and down. This morning, this schizophrenic patient is pacing up and down, pacing. They don't usually pace like this. What is happening to the patient? Do they need their monthly Medicaid shot? What is happening? Do they need another intervention? What is going on? Observe. Right? Misuse of medical device. So we want to use the medical device. All that negligence, all that acts of negligence. Misusing it. You have your blood sugar tester on your ward, but you want to carry it home to check your grandmother's blood sugar. And that's a big lawsuit, eh, guys? That's a big lawsuit. But you will see these things happening as well in the clinical environment. Losing or damaging or misusing documentation. Negligence, fraud, all kind of thing in that. All of a sudden it's lost. The incident report lost. It's damaged. misusing documentation, not following the doctor's instructions. Now, this will have a two-sided coin. You might say not following the doctor's instructions, but you cannot willingly not follow the doctor's instructions. If you know that, or you're questioning the doctor's orders, it is good to question the orders, but communicate, liaise with the authorities higher, your nurse in charge, your nursing supervisors, the lab technicians, the microbiologists, the infection control department, the medical house officer, the registrar, the consultant, the doctor himself or herself, liaise with them before you just not follow the instruction. Yeah? Now we're talking about acts of omission and acts of commission. Right. So when we say in malpractice, there are acts of omission and acts of commission. Malpractice is professional negligence, and there are two types: acts of omission and acts of commission. Omission is failure of a profession to perform an act that they would have performed, such as failure to diagnose bone loss because of radiographs that were not taken, x-rays that were not taken. You're omitting the fact, right? You're omitting that. You're failing to act. You're omitting particular actions that could have avoided the malpractice. So when you go in front of a court of law, and they will say, was it a omission or was it a commission, an act of commission? I know the act of commission now, it's a little close. The act of commission now is the act of a professional who would not perform, such as administration of particular medication, as anesthetic, the amount of anesthetic that a child will get, usually resulting in a drug overdose. Right? So, the commission is the act a professional would not usually perform. Now, okay, I want you all to understand it, right? Because we're talking about negligence, we're talking about malpractice. In malpractice, omission and commission, very close. Omission, failure to perform, failure to do something that could have saved the person's life if you know, and you ought to know because you're a nurse, you was trained, right? You see how tricky it is? Once you know you're a nurse, a registered nurse, if you do not know, people, I'm begging you all, tap into your resources. Don't just malpractice. Don't just practice negligence and say, somebody else, I can hand over that just to the next shift. Yes, them can deal with that. Right? Commission. Act that the professional would not perform. A normal thinking professional would not perform. If you see in a doctor's order that berserk and you do that, you would be charged for malpractice, negligence, and malpractice under commission, the act of commission. Remember we spoke about the Valium, 2 milligram, but you see it look like, let me say 12. You say, this looking like 12 milligram, and you give 12 milligram. Your patient crash and dies. You will be fined for negligence. You will be fined for malpractice under the act of commission. Clara? Omission now is failure of the profession to perform an act that ought to be performed. A patient comes in for chest pain. As a registered nurse, it is my duty. If a patient is having chest pain, immediate care. ECG, immediate ECG. You do your ECGs. Of course, you call your doctor first thing and you let them know. But you don't just call your doctor and you wait in there, By the time you say, hey, patient on bed 5, Jim Jones, he's having chest pains. Okay, fine. Immediately you do call your doctor for me, please. By the time you pull in your cart, you do your ECG. So by the time your doctor sees the ECG or reaches the ward or the ECG results is ready to be read, you can say, okay, the patient is tachycardic. The patient is having signs of brachycardic. The patient is bradycardia, right? Or has signs and symptoms of bradycardia or signs and symptoms of being tachycardic. Immediate intervention or probably arterial flutter. And I know that you all doing the cardiac cycle now. Get accustomed to the terms, right? What is the intervention? So failure to even do that, performing the ECG, something happened to the patient and you go before the court. Swear to tell the truth, the whole truth, and nothing but the truth, to help me God. and when they look at you now and they say, okay, did you do an ECG, nurse? Well, I didn't think it was necessary. Hello? Act of omission. Act of omission. Yeah? So, very close, but similar. And the act of commission now. You do the ECG, but you manage the patient for yourself. You didn't even call the doctor. You did the ECG and you didn't call the doctor. You say, oh, this patient looks tachycardic. Maybe I should give you a amitriptyline dose. Yeah? Because we will slow down your heart rate. Hey! No trouble now. Act of commission. That is not what a normal critically thinking nurse will do. Then you're practicing as a practitioner, which is by law, not legal in Trinidad and Tobago at this point in time. And even a practitioner must practice under the umbrella of a doctor, a medical practitioner. Okay? Again, omission versus commission. So for my biblical scholars, the difference between the two sins, sin of omission and sin of commission. Omission, we fail to do the thing that we should. James 4:17 in the King James Bible says, to us, if anyone knows the good and they ought to do it, and it doesn't do it, is a sin. So you know you're supposed to do, but you didn't think that the patient need a ECG, right? So you didn't do it. Problems. An act of commission, we willingly do the things that we shouldn't. Now we wouldn't go into the biblical sin, right? Based on every person different spiritual beliefs. Yeah? But learn the difference between an act of omission and commission. Learn the difference. Okay. Again, omission. Therefore, to him who knows to do good and does not do it, it is a sin. So you know what you ought to do and you still don't do it. Because you don't believe, you don't think, you don't feel. Remember, we deal in nursing is a science and an art. It is scientific. It is researchable. So these are the things we ought to do. Yeah? Omission errors. Excuse. This happens when a nursing staff forgets to give medication before the next scheduled dose. Now we're still talking about negligence and malpractice, guys. We're still talking about it. This could result in ineffective or delayed response of treatment. Question time. And I really wish I had a live class here right now. But let us go through the questions. You all have my email. what I would like to do is I suggest that you all, excuse me, I'm strongly suggesting that in groups, if we all could team up with groups like, group 1 and group 2, group 3 and group 4, group 5 and group 6, group 7 and group 8, and yes, I would resolve the issue with group 8, right? Soon after the exams, yeah, God's willing. Team up in groups and come and have your questions, and at least let the two class representatives excuse all the groups submit their questions. Hear what I need you all to do at the end of this presentation. I would prefer, please guys, please, I don't want to get 32 questions, yeah, or 32 persons asking me the similar questions. So let the two groups or four groups, let me say group 1, 2 and 3 and 4 come together, or group 1 and 2 come together. I think it would be better that you all work that way. Team up, whatever group that you all want to team up with. If group 1 wants to team up with group 8, if group 4 wants to team up with group 6, if group 2 wants to team up with group 7, up to you guys. You are all adults, you all could work it out, right? So team up in groups, subgroups, so team up into major groups and formulate questions that you all would like to ask based on this presentation. Send it to the class representatives, please. We have 2 class reps. Send it to your class representative, and they now will tailor, put together the questions and forward it to me on one document, 1 page. Yeah? And I would respond to those questions. Yeah, at a later date. The faster you all do it, the better. So come now, everybody, you need to pay attention to this class. A patient is given an incorrect dose of Valium by the nurse. Negligence or malpractice? Is it an act of omission or an act of commission? Answer the questions. To yourself, eh? Pharmacist label the drug incorrectly. The nurse gives the full dose to the patient. So, the drug came from the pharmacy with an incorrect label. But you take it into consideration, simple Panadol, right? Panadol is one of the safer drugs. However, in administering or taking Panadol, if you take any, as that with any drug at extra time, it can hamper your organs, your vital organs. So in this event, an overdose of Panadol targets your liver. Yeah? Your liver is one of the organs in your body that filters the blood, right? It works together with the spleen as well as the kidneys, the pair of kidneys, right? It filters and cleans out all the toxins in your blood, along with your lymph nodes as well, but we wouldn't go all there. So you're given Panadol, or you take it for granted. Panadol safe, man, get them to Panadol. Something happens to the patient. What happens? Who is responsible? And 6 months down the road, yeah, it's not overnight lawsuit. 6 months down the road, what happens? Lawsuit. You are called to court. Is it negligence? Is it malpractice? What part of it was negligent, or what part of it was malpractice? Nursing staff forgetting to tell the patient Q2 hourly as ordered by doctor. The patient now developed a bed sore. So your failure to perform an act is what? And because of that, your failure to perform the act, patients develop a bed sore. Negligence, malpractice, both. Which part is negligent and which part is malpractice? Is it an act of omission? Is it an act of commission? Think. Critically thinkers. Nurse did not administer medication because the patient refused. Were we negligent? Or did we practice would we be charged with malpractice acts? Or was it none at all? I would love to debate this with you guys. Patient was misdiagnosed and taken to OT and had the healthy limb removed instead of the sickly ill limb. We spoke about that. Patient falling off bed, resulting in broken hip because bed rails were not up and locked. Nursing student reporting for duty and signing in 7 a.m. instead of 9. What is this? We're talking about civil laws. Having a colleague sign in for you when you're running late. And let us hope that is not happening. No. Yeah? And when you get on the wards as well. Legal terms, again, we're talking about duty and breach of duty. We're winding down. Duty of a professional toward an individual. That duty is established when the nurse-patient relationship has started. So it is your duty as a nurse to do nursing care when your patient is have admitted themselves or they are admitted to their healthcare institution. It is your duty. Breach of duty, however, is when nursing care fails or do not accept to give that care to the patient, or even though you accept the care, but you fail now to perform your care in a particular standard. Breach of duty. And what do I mean by that? All right, let's deal with the definition, right? Nursing care falls below acceptable standards or care or the nurse was neglected. The nurse was negligent. Oh my gosh, sorry. So you're taking care of the patient, but mediocre care. That is a homeless vagrant in Port of Spain, yes? You give them anything. Care bound for that. Breach of duty. Breach of duty. So it is our duty to treat every individual fairly. Yeah? Mandatory reporting. Nurse Samuel spoke about that. And she spoke about nurses. We are legally mandated to report abuse, neglect, gunshot wounds, dog bite, communicable diseases, some communicable diseases that are unsafe, illegal practices done by another healthcare provider. Yep. So don't cover for your friend. You talk to them once, you talk to them twice, and that is a habit. Everybody will go down, Everybody will go down. Right? So CYA. Cover yourself. Informed consent and refusal of treatments. If a patient refuses, document. Inform. If a patient refuses treatment or a patient says yes, they want to get the blood transfusion, yes, you report that. If a patient refuses, yes, you report that also. We ought to report. Rights of drug administration. Now, we have a lot of rights. Patients have rights. You must have the right drug. And I will go in depth with this with you guys after the exams. But I want you all to learn this for the exams as well. If I say out of this, let's see how much you have. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 rights. If I say list for me, yes, 10 rights, good right there. If I say list for me 5 rights out of the 10 rights of giving proper drugs, what are name 5 rights? I expect persons to name at least 5 rights. You must have the right drug. The patient is on Panadol, not Propofol. Have the proper drug. Right drug, Panadol. Right patient, Jim Jones. Right dose, 500 milligrams. Right route, PO, meaning per oral, going through the oral cavity, mouth. Not injectables, not per-rectal, not sublingual, under the tongue, not intramuscular, not intravenous, but per oral, PO. Right time and frequency. This is 2. Time, doctors want it every 6 hours. So you're getting it 6 a.m., midday, 6 p.m., 12 midnight. Frequency, right? So you're correct to your right time. If it's Q8 hourly, 8 a.m., or you say 6 a.m., 2 p.m., 10 p.m., 6, 2, and 10. No, yet or Q12 hourly. Frequency is 12 hourly. 6 in the morning, 6 in the afternoon. That will be your time. So your time and frequency work hand in hand. Write documentation. Sign off properly on your drugs, stating you did it at what time. If you did not pull up any drugs, do not sign for drugs that you did not give. Right? History or assessment, an assessment. So you saw the patient was having an allergic reaction. You take the history, but yet still you're giving the patient medication again, the same medication that they're allergic to. Were you trying to kill the man? You're trying to kill the patient? You're causing harm. Breach of duty, malpractice, negligent, fraud. Go home. Yeah? Assessment. Patient say, Nurse, I think I'm having a allergic reaction. I just ask, allergic reaction? What type of reaction you having? Well, I'm having an itchy throat. I find my throat swelling. I'm getting hives on my face swelling. I'm getting short breath. I'm getting a red patch all my back. Don't just take it for granted it's an allergic reaction. Because the patient say and your patient refuse based no. Assessment. Yeah? Drug approach on right to refuse. You go to give the patient the medication, patient refuse. Right? That's alright as well. And you document, save yourself. Drug and drug interaction and evaluation. So there's the drug interacting, because there are particular drugs that interact with particular things, other drugs, and then when you look at the leaflet on the drug, they will say it's contraindicated. We will discuss what is a contraindication. And for drugs that are contraindicated to other drugs or other conditions, you ought not to give. Example, you know a patient that have liver failure. Doctor prescribes Panadol. Panadol is one of the safest drugs. But the patient has liver failure. Would you give the drug? No, beloved, no, you don't give the drug. You bring it to the attention of the doctor. Doc, I saw that you prescribed Panadol for the patient. 1 milligram or 1 gram, right? But the patient has stage 4 liver disease. You sure you want us to give this Panadol? Right? It's an antipyretic, yes, but there are other drugs, non-steroidal oh my gosh, NSAIDs, non-steroidal anti-inflammatory medication. That's what NSAID stands for, right? And you still give the drug. No. Breach of duty. That is negligence. You're malpractice. You're willfully doing a wrong act. Commission or admission? Learn the differences, right? Education and information. It is the right when you when you're going to give medication, you know your side effect of your drugs, your interactions, how your drug will act. If it's indicating to any other drugs or any other conditions, you would not want to cause harm to your patient, right? Good. So, Nurse Samuel spoke a bit about patient's possessions and valuables. So let us quickly go into this as we wind down. Nurses are responsible for safeguarding and respecting patients' and clients' personal possessions and valuables. They must not, under any circumstances, borrow, steal, or beg for the personal possessions and values of a client. Get that? Policies and procedures relating to the safeguarding of the client's personal possessions and valuables may vary a little from one healthcare facility to another. Sorry, guys. As nurses, can discourage clients to retain personal possessions and valuables while hospitalized, or they should give the valuables to the next of kin, that is what NOK stands for, or a trustworthy family member. Right? Securing and retaining personal possessions and valuables in a locked and secure safe using an envelope that fully documents the patient's name, the room number, the content of the envelope, including things like jewelry, cash, and credit cards that were collected from the clients with their permission. And of course, when you do that, you ought to also have a witness. Don't just go and collect things on your own, right? When the client is discharged from the facility or they choose to have their personal possessions and valuables returned to them, the nurse and the client with another person. In our setting, always get another person to witness the returning of the valuables to them. The nurse and the clients check and confirm that all the items listed on the envelope is indeed the same as what is in the envelope. Listed on the list is in the envelope, and the client signs a statement and documents that they received all the items that they had given to the nurse and to return. Now, remember in class, Nurse Samuel spoke about the incident on the ward. Share with your colleagues that wasn't there, right? Please. So here we have a popular artist, Shensia. Yes, guys, I listen to Shensia. Cheng Ying. Yes, sometimes. So, Shensia visits Trinidad and Tobago, and she was dehydrated on the streets of Port of Spain, and she collapsed. You, as the student nurse, is in casualty when her entourage brings her in to casualty. Now she bling in, right? So she have all she bling on her. But doctors want to keep her overnight for observation. How are we going to document this jewelry? So yeah, she's in casualty, semi-conscious. She's conscious, yes, but she fell down, she bumped her head, she was dizzy, she had a dizzy spell. She had a blackout for a while, and we need to keep her overnight because she's massively dehydrated from all that, partying and enjoyment of our festival activities and carnival. So now we have to take the this big gold chain around her neck, because that's what we're seeing. We're seeing a big, thick gold chain around her neck. So she have two chains. A big, thick gold chain around her neck. It appears to have diamond studs in there. And she has another one marked rich. Rich, yes, rich. It seems also to be gold as well. How are we going to document this? Are we going to document what we see? What we think we see? Because I think I'm seeing a big what Spanish link? What link is this? I'm not sure. I'm not, And gold with diamond studs. Am I going to put that in my documentation? So yes, now we place the items in an envelope. She agrees to give us, so we place the items in an envelope and we list it and we describe it now. She probably had a ring with a purple stone, or a yellow metal bracelet, or a white metal necklace. rather than the 14-karat gold bracelet or a sterling silver necklace, because we are not jewelers. We cannot determine, confirm, or deny. So for Shansia with that big necklace, should I write big chain link diamond gold chain? Nope, I'll be incriminating myself. If she just dip it now and have it as a Brazilian gold, or she just dip that, I'm not saying, because she has elevated from her lifestyle. But peradventure, that's what it is. And she wants to sue. Am I incriminating myself by saying, and she say, yeah, I was suing because that value $500. And based on my documentation, I said in my documentation that it's a diamond and it's gold. What I have to find back for Shansia? Yes, I have to pawn my house, my car, my everything, right? And go down to Marat Jewelers and get exactly what I said. That value must be about $25,000. I incriminated myself. So the items are listed in the envelope that appears to be gold, silver, or ruby. Indeed, may only be inexpensive gold, or silver, or ruby, looking alike. As nurses, we do not know. We are not jewelers. We do not test any gold. So we say it's a yellow metal, silver looking metal, red stone. So I would describe the chain as a yellow looking chain, a yellow looking metal chain that appears to have this chain link. If you measure it, right? And you put that in the, she could say, no, this is platinum. Hello? Yellow looking. No, this is diamond. Hello? Clear stones. That appears to be looking as if, right? We do not incriminate ourselves. Consent. You all get that, eh? Please. Who can legally sign a consent? Individuals of legal age over 18 years. Under legal age but have a valid marriage certificate. Excuse, but that have been omitted now because our laws have changed. Emancipated minors, excuse me guys. Oh, emancipated minors. And that's in certain states in America. I have not heard of any matters here in Trinidad and Tobago where we have emancipated minors. A parent or legal guardian of a minor, spouse or next of kin of an adult who is unconscious or mentally incompetent. So Nurse Samuel was also speaking about spouses that would have had different type of intentions, and the Mental Health Act will cover them. So when they go before the tribunal, they will decide and they will weigh all options. So it's not just a fly-by-night thing, yeah? Conservators, right? Court-ordered consent, that will work hand in hand. Telephone consent, emergency consent. So yes, you can have consent over the telephone, but then again, you must also have when you're having telephone confirmations or even consents or even doctor's orders, there is a way that we ought to do it, and we repeat it aloud, and you must have somebody next to you who is able to document that order. Excuse. So we're talking about student nurses. Are you all liable? Yes, you are liable. Student nurses are liable if they cause harm to patients. Do not do skills that you have not been taught. Make sure that you are carefully supervised when you perform procedures with patients. make sure medication administration. And I want to say something to the male students, particularly to the male students. You may go up in the female wards and you may be with surrounded by female patients. Now this works both ways, for male and female, and even male and males now, and female and females. Yeah? Always try to have a chaperone. Meaning, but particularly for the males, you might be on a ward where you have a lot of young females, and we have a lot of, here on our this batch of male nurses, we have a lot of young male nurses in the batch, and even full male. So it's, as I say, it's across the board. And you have mentally ill patients, whether male or females. Whether you know the diagnosis or not, try not to be in an area with them alone so that they can call or imply anything on you. Young males, young females, adult males, adult females. I am speaking to all students. Everybody. I'm speaking to all students. Yeah? Please do not go into the area alone. Right? Always have a chaperone. Because you don't want to be accountable and you don't want to be held liable for anything that did not happen. Unlike first world countries, we do not have cameras and what? Right? So, try to avoid any issues whatsoever. Even from taking it from your student career onto their professional career. Medication administration. Yes, you ought to be supervised with that as well. When the IV starts, catheterization, suctioning, we'll go into that. Prior to giving medication, make sure you check. Then we're speaking about medication checks. We looked at all the checks. You're checking your patient ID band first, and not only the ID band. You ask the patient what is their name. You might be know their name because there's a regular patient. The patient is on the ward 10 days, 5 days, long stay patient. What is your name, sir? And you check the ID band. You want to make sure you do all your checks. Look up and you research your medication that you are giving. Don't just give a medication and don't know what it is. So you must look at the contraindications of your medication. If it's the drug interaction, if it's reacting with other drugs, or the other condition a patient may have. When the drug would actually start working. Yeah? And you check the patient for allergies first. Before you even do anything, you check for allergies first. If a patient is allergic to a drug, it ought to be written in red. If it was missed by another staff member, it is required that you, as a nurse that is giving the student nurse that is giving the medication, you write it and you inform. Yeah? Why documentation? And we will go through our whole, when we get back from exams, we'll go into the documentation and the importance of documentation and how we ought to document. And I will show you all of report writing in terms of documentation and incident reports. It helps achieve continuity of care because it provides for communication amongst caregivers, and it records the patient's progress. Right? It provides a legal record for care provided and means to verify services rendered and for insurance payments. And not only insurance payments, but it verifies your actions as nurses students. Effective communication, consistent with professional and agency standards. Remember, we spoke about it's supposed to be factual. It's not about your opinion. It's not about your views. It's based on the facts. Yeah? Complete. You don't just say, patient seem unstable. I don't understand. That's incomplete. What do you mean by unstable? Or patient is tachycardic. Or patient has, and I'm talking simple, patient have high blood pressure. Okay. Patient is hypertensive. Okay. Where is your science behind that? That's incomplete. Meaning, where is the result? Did you do the blood pressure? Is it 198 over 120? You're comparing now the systolic and the diastolic readings. The patient is tachycardic. Where is the pulse? Did you do a pulse? Did you do a machine readable pulse that says the pulse is 144? beats per minute? Or did you do a manual? Did you repeat it manually and say, yes, the patient is indeed tachycardic? I did it manually, and the result is 140 beats per minute. It may vary between the two, but the patient is indeed tachycardic. So you give a proper assessment. It's complete, it's accurate, because you repeat it. Even though a patient, a nursing assistant will say, yes, I did it, nursey, and the pulse is 140. Did you get it from the nurse's station and do a manual and check it? Recheck. It's not that you didn't believe her, but we must cover ourselves. Did you make an intervention? Right? Is it accurate? Is it concise? Meaning, is it complete? Is it complete? Meaning, is it factual? Patient refused medication. Concise. Is it precise and concise? You're documenting. But is it a summary, or you want to go on and on about the day before and the day before and the day before that? No, that's not your concern. Your concise documentation is exactly what it ought to be. Concise, meaning, this is exactly what I want to say. You're given a narrative of the incident, what happened, what occurred, but you must have it concise. You don't want to start from once upon a time. Irrelevant. Factual. Look at the characteristics of effective communication documentation, please, people. Please, I beg and all you. Is it factual? And I will bring some of these questions in multiple choice, and it will be mixed, right? So it must be factual, not your opinion, not your feelings. Your feelings and your opinion will guide you into making nursing interventions. Your gut feelings. But you don't write that. That is not part of the documentation. I called the doctor because I felt as if the patient was having on the verge of having a MI. What? What craziness you talking? What craziness you're writing? You can feel it and act on it, but you don't document that. You don't document that. Well, I did feel as if, no. Nope. If you could stand up in the court of law, maybe you can say that. They say, well, nurse, what made you make that intervention? And you had a gut feeling of whatnot. But you don't document that. It must be organized and timely, and I will go into that with you all as well. It must be legally prudent, meaning that it must have legal terms. We cannot write how we speak. What I mean by that? She did go down the road. The patient, she did climb over the banister. Excuse me? Weren't you trained? Right? We have something called nursing jargons. And I did wipe down the table to remove the germs. Hello? Excuse? No. Nope. We use specific antimicrobial wipes to remove any signs or any suggestions of microorganisms on the counters, on the medication trolleys. Documentation, right? And of course, it must be confident. So we must use the legal terms. It must be legally prudent, and we must be confidential, right? When we documenting on the boards or the report, you must not put there are particular acronyms that we would use for persons who have HIV, the HIV status, or herpes and any viral illnesses. There are particular things we use for that. Documentation in nursing practice is anything written or electronically generated that describes the status of a client and care or services given to that client. It is written evidence of interactions between and amongst healthcare professionals, clients, families, and healthcare organizations. The administration of tests, procedures, treatments, and clients' education. It results in clients' response. The results or client's response to these diagnostic tests and interventions. So documentation basically is a host of all the connections from admission to discharge, everything that happens in between. there, and we would go through this. I would not bring this particularly for the exams, this part of documentation for the exams, so I don't want you all to worry too much about that. Things that I want you all to look forward to, although boom, boom, boom. Let me just give you all a little tip, right, for the exam. Well, of course, legal documentation, these slides and what we learned coming back from. Okay, good. So to be continued after exams, right? In conclusion, some tips. Everything that was taught in this slide, this PowerPoint presentation, as well as what was taught prior when we came back out from the holidays, a few let's say mental health, definition of mental health, a few of the definitions in that aspect. I would bring some question on ethics, because I found that persons wasn't really didn't really answer much, but I'll bring that in more terms of long questions. I am not certain about I'm not certain. Okay, so I will mention that. Pertaining to Ms. Samuel's presentation, according to your Mental Health Act, I want you all to define mental illness, and also based on your knowledge, define definitions, of course, of all our legal terms here. What are the different types of admissions she spoke about? You all need to know that there is a particular term that she used for persons under the age of 18, and I would like you all to get to know what that is as well. Oh, tell me something about the sectors, because she did mention sectors in the mental health, right? What you all have learned with the nursing process. I will bring a question on that as well. I will also bring a question on medically recommended persons for admissions versus voluntary. Alright, so questions like that, I would like you all to please topics like that, I would like you all to please review, and of course all your definitions and terms here that we spoke about. Remember, we spoke about the laws, torts, malpractice, submission, commission, sorry, I'm tired, and medicated, right? So review, and as I said before, I would liaise with Mr. Murphy, and I will try to have my exams on Thursday afternoon at 1 p.m. My exams ought to be like a 2 and a half, probably a 2.5 hour. I will structure the paper, and I would let you all know, right? So via Mr. Murphy. So please, guys, enjoy while you be safe, and be safe, yeah, and be healthy. Okay, so I will see you all on next week Thursday, God's willing, and all the best in your exams. All right. These are some of my references. I would sort out my references after. Yeah. All the best of luck. Bye, guys. Take care. Enjoy.